नवा आवाज नहीं कर सकते अब, मुझे नहीं पता था.
Hello. Okay. Good evening, everyone. My name is Rumil Patil. I'm the Vice President for Capacity Building in MSCI India. Today, we are joined here for a webinar on 360-degree radius, a peek into the world of orthopedics. We are joined by Dr. Tushar Mehta. He's an orthopedic surgeon, an educator, a motivational speaker, creator of this amazing page called Orthopedics Plus, and he's also passionate about entrepreneurship as well. A coveted member of several bodies of orthopedic associations and credited with more than 1,000 trauma surgeries, total hip and knee arthroplasties, arthroscopies, and spinal trauma surgeries. He's all this and much more, and we're thrilled to have him with us. Welcome, Tushar, sir.
Hello, hi everyone. Thank you so much for this introduction, and it's really my honor to be here on this platform with you guys. I'll be very honest, it feels, it's very nice to be with the young blood and the young generation who are utilizing not only the traditional teaching, but also all these, the budding innovative technology based platforms to connect to different people. So I must appreciate and congratulate you.
Thank you, sir. Thank you so much. So let's start with the questions right away. And one of the important question which a lot of people ask to a person who have achieved so much is what motivated you and inspired you to take orthopedics?
Okay, so good question. What motivated me to take orthopedics? See, as far as I'm concerned, I'll tell you, I come from a small town in Haryana. So I come from a family of doctors, though. But I was pretty much clear in my head about certain things, and one of those things was that I have to become a doctor. Now, and when we talk about orthopedics, I will not say that I decided my mind, in my eighth or tenth or nothing like that. I mean, there was a friend of my father, an orthopedic surgeon. So I used to see him a lot. I used to visit him a lot. My grandmother had certain, orthopedic issues. So whenever I used to go to him, I used to have this kind of a vibe that, that was my first exposure to orthopedics. So my stimulus of orthopedics actually came from that very moment. But when I entered into the medical college, then again, my orthopedic professor, I mean, he was quite famous, and right from my first year, I kept hearing about him. And it was in my, I think, final year, I attended one emergency orthopedic surgery. It was, I remember, an open fracture of tibia. Debridement was being done, and they were putting a fixator in one of the minor OTs. So I could feel that, this is the branch that I relate to. This is the branch that I want to be in. uh, it is a little unfair to say, but yes, I could feel, the macho people, they take up orthopedics. I don't know. I had this. I mean, it was a small kid, thought process. I'm not saying that, it should be followed, but yes, I could feel, the X factor into the branch, and I thought that, I should take it up. So that was my stimulus. But then, yes, of course, I got influenced by many orthopedic surgeons during my MBBS also. I did a research paper on thresher injury. I was in my third year MBBS. So for that, I'll tell you, I came in touch with an orthopedic surgeon. His name is Dr. Matthew Varghese. If anybody knows anybody about orthopedics, anyone in orthopedics, you will hear his name. He has been called as the doctor of century by Bill Gates. So even Bill Gates, in his book, in his website, has mentioned about Dr. Matthew Varghese. He's heading St. Stephen's Hospital, Tis Hazari, Delhi. So in my third year, I did a research paper on thresher injuries in agricultural areas of Haryana and Punjab. So for that, I came to Tis Hazari, I came to Stephens, I met him, and that day it was pretty clear in my head. If not orthopedics, then I will, I will not even practice medical science. I mean, I will not be even calling myself an MBBS. मैं सब छोड़ दूंगा, मैं पहाड़ों पे चला जाऊंगा, कुछ भी करूंगा. But yes, बनूंगा तो orthopedic surgeon बनूंगा, नहीं तो कुछ नहीं बनूंगा. So that is how I started.
Wow, thank you, sir. That was really insightful. Now, the second question, which people generally ask is, what is a normal day in your life as an orthopedic surgeon?
I will tell you about this also. When we talk about a normal day, I can categorically, I can compartmentalize it for you. Like, if you're talking about Tushar Mehta as a senior resident, which was about almost 10 years ago. So, as a senior resident, my job was to go to a hospital, whether government or private, take orders, write down the notes, attend OT, attend ward, and probably do what I'm asked to do. I'm a salaried person. But when I started, I was salaried for a very small period of time. I did a SR ship for hardly about 6 months. Then I became self-employed. When I said self-employed, that means I had to wake up every morning. I had to go to different hospitals. I used to ask them for work. I used to give them my visiting card. I used to ask them that whenever you have any case, right from trauma to spine to anything, you can call me. I will come and operate. So those days were tough. I was setting up a practice for myself. I was setting up my patients. I was connecting to people. I was not charging money. I was doing half of the things for free. So that time was tough because every day I had to, dig on my well and drink water from that. I was not salaried. I was not getting any assured money from everyone. Now, why I'm saying this is, you have asked a very valid question, but I will prolong my answer here. Uh, आप सब बच्चे अभी छोटे हो, you guys are in MBBS or maybe if some post intern is there or not. There are four things. There are four phases of life. Matlab, I want you people to understand. It's not about only orthopedics. It's about four phases of your professional life. आपने सुना होगा एक इंसान की जिंदगी में चार फेज होते हैं. वो क्या एक बालक होता है, उसमें फिर वो शादी हो जाती है, फिर समथिंग लाइक दैट, ऐसा कुछ बोलते हैं, वेदों में होता है. मैं आपको बताता हूँ what happens in a professional life. There are four phases. I will not tell you the fourth phase. I will tell you the first three phases. The first phase is salary. So once you will be done with your post graduation, you will be salaried. When you will be salaried, you will get an X salary, 1,50,000, 2 lakh, 3 lakh, जो भी है. Your only tension will be to get up in the morning at 9 a.m., go to the hospital, do your work, अपनी attendance लगाया, and you come back. Every fifth or seventh of the month, you will get your salary. So you are not supposed to take any tension. That is the first phase, the most easy phase, the most lucrative phase, and I tell you, the phase which is responsible for the death of aspirations of a doctor in more than 90% population. 90% डॉक्टरों की उम्मीदों की मौत सिर्फ इसी पहले फेज की वजह से होती है, क्योंकि वो ये सोचते हैं कि इफ आई विल बिकम अ रेडियोलॉजिस्ट आई विल अर्न 3 lakhs a month, आई विल बिकम अ कार्डियोलॉजिस्ट आई विल अर्न 5 lakhs a month, आई विल बिकम अ न्यूरोसर्जन आई विल अर्न 7 lakhs a month. जब आप एक महीने की सैलरी कमाने के बारे में सोचते हो, आप वहीं खत्म हो गए. फॉर मी दैट पर्सन डज नॉट एग्जिस्ट. Although you all will have to go through that phase, you all should go through that phase, but the point is that phase should not last beyond 3 to 5 years. I'm not denying that you're not supposed to go through that phase. You're supposed to go through that phase, but that phase should not last beyond 3 to 5 years. After that phase one, you become self-employed. Now, what happens in self-employed? You get up every morning. You are not supposed to take any tension that I have to reach the hospital at 9 a.m. and mark my attendance. You can get up at 10, you can get up at 10:30, but you have to understand that you have to go to a hospital. You have to make sure that you search your patients. You have to search for your OPD. You have to search for your IPD. You have to search for your surgeries. The amount of money that you will be earning, that will be almost yours. 80% will be yours. There will be a day when you will earn 1 lakh a day. There will be a day when you will earn hardly 5,000 a day. If you are sick one day, you will not if you are not going to work, that is not going to be counted in your money. So that part is already gone. You have to wake up every morning, dig your well, take out water. The day you are not going to wake up, no water for you. So first is salaried, which should not last beyond 3 to 5 years. The second one is self-employed, which should again not last beyond 3 to 4 years. Then comes the third phase. After salaried and self-employed, then comes the third phase, which is the most hectic phase. That is the phase of being a businessman. In India, a businessman is considered to be an abuse. लोग इसको गाली मानते हैं. That, oh, he's just a businessman. Actually, being a businessman is an art. It's a tactic. It's a skill. When I tell you to become a businessman, that means you are an orthopedic surgeon. Agreed. You hire five, six other people who have just entered into what? Phase one. I told you about phase one, right? Who are salaried. So you actually are now giving salary to 5 to 6 other specialists who are physicians and surgeons and gynec and everybody. They are working under you as a salaried person, and then whatever money they are earning, they are getting a fixed salary and some incentives from that, and rest of it is coming to you. So in that way, you are utilizing most of your time, as you're, of course, you are doing your own work also, plus whatever work others are doing, you are getting a, money out of it, and you are creating job opportunities. I'm not saying that you have to become a businessman as a doctor only to earn money, to fetch money. You have to create job opportunities for all these people. Why today there is a problem that, I met a couple of days ago, I met someone, the she has just passed MD radiology, but still jobs are limited. Why? There is a big problem in medical field right now, that is underemployment. Why there is underemployment? Because the big businessmen, doctors who have become big businessmen now, they are not creating enough job opportunities. They want to earn everything on their own. So when you become a businessman, you loop another 5 6 specialists, you create job opportunities for them, and then you become even more. Then you raise one level higher. That is the point when I say that I feel that you have actually taken out the actual, output from your profession, actual output from your life. By the age of 40, I think you should have crossed, you must cross the phase of being a salaried guy, then a self-employed guy, and then you should become a businessman. The fourth phase is still pending, and that will always remain pending. That I will not be telling you anyone right now. I am currently between third and fourth phase. By God's grace and by well wishes of everyone around me, I could clear all the phases a couple of years earlier. So I'm between third and fourth phase. The day I will, successfully set up my fourth phase, I will do a Zoom call again. Now you asked me that how, a day is like. So day is depending upon the phases. When I was salaried, I was the most happy guy, no stress, no anxiety, because my seniors are there. A patient is going to be admitted on their name. We are going to operate him on their name. All medical legal litigations will be there on their name. When I become self-employed, half of the time I was driving, wearing a tie, giving my visiting card to different doctors, trying to establish my name, trying to making sure that every good surgeon, physician, gynec, cardiologist, they know that there is someone called Tushar Mehta who is an orthopedic surgeon, and if at all something happens, we can give him a call. The third phase, which is currently I'm in right now, being a businessman into the medical profession, this is full of ups and downs. Morning 9 a.m, you see a WhatsApp that shakes you to the core, but evening 6 p.m, you get some message that makes you so happy. So it is all about, crust and trough every day. I'm just, and this is the most enjoyable phase as of now. You have to have an appetite for that. You have to have a high risk appetite for that, for the third phase, and this is a very interesting phase.
Thank you so much for that answer, sir. So moving on to the third question. It is a common conception amongst most of the people that orthopedics is a male-dominated profession. So, what are your thoughts over the same?
I have been talking about it. I've been very vocal about it for last almost now 4 years now. Uh, the reason being that in 2016, if I correctly remember, I met a girl. I don't think that she's attending the lecture right now, but I met someone in Mumbai. After my lecture, she came to me and she told me that she was my student the previous year, and she said that I want to become an orthopedic surgeon. I said, great. I was getting late for my cab and I had a flight back to Delhi. So I said, that's great. My best wishes. She said, but my parents need to be convinced. I said, for what? She said, they are telling me that it's a male dominated branch and even the patients would not come to you, and you have to be muscular. You have to have that muscle power. You have to have that height and everything. I convinced her that, okay, fine, this is my mobile number. Right now I'm getting late. And once I land in Delhi, tomorrow maybe I can talk to your parents. The very next day in the morning, when I woke up at around 7:45, 8, I saw around 4 or 5 missed calls from her, and I was feeling very weird that, why she's calling again and again. And then at around 12:30 in the afternoon, I called her. She said, sir, it's a request that please talk to my elder brother. I spoke to that man, and he started, bombarding all those queries that, do you think if anybody in your home requires an orthopedic surgeon, will you allow a female to do that? I said, boss, first you have to understand that it is a myth that it requires muscle power. There is nothing like that. There is no need of any muscle power. You are in a government setup. Some of you might be in a government setup. So you must be aware of the fact that, okay, fine, it requires a muscle power since half of the things inside the OT are not working to the level they should be. So वहाँ पे ठीक है, if the traction kit is not working, you have to apply a lot of power to, apply traction to it. But once you come to a, fully, state of the art operation theater, there is so much sophistication in the instruments that even just, pulling a small thing is going to do your job. We have all automated drill machines, and even now the robotics are coming in. So first of all, hardly any muscle power is required. You may need muscle power, but not that much. Second thing is, there are currently many successful female orthopedic surgeons who are doing so well in the country. Uh, they are heading the department in AIMS Rishikesh. They are heading the department in CMC Vellore. They are heading a big corporate hospital in Mumbai. I did an interview with one girl orthopedic surgeon. She's in Amritsar. She's in GNC Amritsar in third year. I can tell you the statistics for 2020, that you know that now by counseling has happened. So at least what I have counted, I am sure that my numbers are underestimated. But at least 30% things are doing well and things are doing fine, and people are doing fine. So girls are there in orthopedics. There is no problem about that, and I think girls should be encouraged more to join orthopedics. This should be discarded now.
Thank you so much for that answer, sir. Um, Now coming to your challenges. So, what are the challenges and problems you face as a practicing orthopedic surgeon?
Uh, you want an honest answer, or you want some diplomacy?
No, sir, completely honest answer.
Completely
Thank
honest.
you.
Okay. Uh, I will again share a personal experience. So once my post graduation was over, I spoke to a friend of mine and I told him that we should start our practice in one of the posh areas of Delhi. So we opened a small clinic and we bought an X-ray machine because that was a necessity. And what we did was we invested, I don't remember exactly, but we invested around 14 lakh or 13 or 14 lakhs of rupees in establishing just a clinic with a minor OT, with an X-ray machine and pharmacy. And rest of it, we thought that if at all there is any major thing that comes, we'll make the patient go to a bigger hospital. Guys, I'll be very honest that within first 3 months, I could not earn more than 80, 90,000 within 3 months. I'm not saying first month, within first 3 months. So that was practically 30,000 rupees a month. Even the EMI which I was paying for the X-ray machine, it was little difficult. And coming from a medico family, my father is a doctor, established one. He said, "You're just wasting your time. Come and join me. That's all." I said, "No, I just want to, maybe explore more." And then after 3 months, I got to know that there is a senior orthopedic surgeon who is just about a kilometer away from this place, and he's charging 100 rupees for OPD. Our fees was 250. So, of course, 15, 20 years more experienced guy in that locality for last, maybe 20 years or something like that, and charging just 100 bucks, and we were charging 250. So I decided with my friend that now we will reduce the fees to 100 bucks. So we reduced our OPD fees to 100 bucks. We said that, okay, fine, if you will pay us 700 rupees for the plaster, that will include the plaster cost also, the bandage that is used for plaster. Another 3 months we analyzed, and I could earn hardly 70, 75,000. So our earning was dropping down with every month, and we wanted to find out the reason why. Then I got to know that there is a general practitioner in that area who is there for last 30 odd years, and he charges most of the times he doesn't charge any OPD fee to examine a patient. He dispenses medicine. I just hope that some of you will understand. We write a medicine, the patient goes to a pharmacist and buys that medicine. There are certain people who dispenses medicine, like they sell the medicine on their own. They are sitting in a chamber, they have medicines around them, and anybody who comes in, they examine that person for free and they give medicine and they take money for the medicine, and the the patient also feels good. Doctor has not charged me anything just for the medicine part, because medicine has more margin than anything else. So he was earning lakhs and lakhs basically because of the, the medicine part. So after about 6 7 months, when I got to know about him, I asked my friend, I said, so what do you think now? Should we also start the same after spending 8 9 years and being so qualified? So we laughed and laughed, because there was the only option that we had left, because no money was there and we were not able to pay our EMIs also. That was the biggest challenge that I faced. And on that very day, I realized that, Tushar, it is not going to be easy. It is not going to be easy to fight with your peers, because that day, of course, I met that senior orthopedic surgeon, I met that general practitioner, I met everyone, that please support us, please support us, we do this, we do that, we are trained in arthroscopy and all that stuff that anybody does for his marketing. I say I did everything, but they asked for something. And what was that something? I'll be very honest, they asked for kickback. They said, if I will, send you a patient, and if the patient's bill is 1000 rupees, I need 400 300 out of that. I said, but why? The patient is coming to me, I'm using my skill, I'm treating him on my own, why do you want to kick back? He said, this is how the medical, the thing works. That's why I asked you, if you want an honest answer, the first basic challenge is your own fraternity. It is your own peers. It is, we have around 400 people right here. I always request on every platform, whether in an online session or an offline session, guys, medical community is a very small community, please have unity. And that is why I appreciate all these young bloods who are coming up with all these things, that I feel so good that you guys are so united, you guys are working so hard, you have formed associations and you are working under banners. Please make a big community, make it bigger, bigger, bigger. But more important part is that please have unity amongst yourself. We have to stop this practice of kickback. We have to refer patients to our colleagues without asking for any favor. Because if you will refer a patient to me tomorrow, if I know that you're a cardiologist, I will refer a patient to you as well. Where does this money part come from? So the initial practice is just to make sure that your peers support you. That was the biggest challenge that I had. And I went from pillar to post to encounter that. I convinced all the doctors around me. I made sure that I conduct CMEs and seminars almost every fortnight to convey to them that yes, I'm very good in doing certain surgeries, and if you will refer those patients, I'm going to give you the result. I was always convinced in telling them that I will give you the post-op results. They were said, no, but what apart from results? I said, money part is not possible because I'm already doing at a bare minimum price. But then I had to compromise again, as everybody does. So for you also, when you will start your self practice, the only problem will be that you will have to first convince your peers. Then of course you will have to convince your patients. And I'm telling you, no online marketing, no Facebook, no digital marketing, no social media, no Twitter, guys. No marketing platform is going to help you. No matter you shout out loud on Facebook and you get reviews from people saying good things about you, the only practice which is going to make you a successful doctor is word of mouth. If you treat a patient well, if that patient gets results, I'm telling you, the patient is going to tell it to 10 other families that, okay, this happened, that doctor helped, this happened, that doctor helped. So there is no online offline marketing which is going to be helpful for a doctor as compared to the word of mouth marketing, which you will have only if you treat your patient well. So work hard on your patient. Yes, word of mouth is the key. So that I learned it the hard way. For first 2 years, I believed that paying back, the kickback practice to other doctors is going to be helpful. But after almost 2 years, I understood nothing works except your patient. So that is I gave you my problem and solution also that I had.
Thank you, sir. Thank you for that answer. We have a few people who have written their doubts on the chat box. One of them is, in this field, it can get really hectic. And how do you manage the family life equally with the career?
See, again, something that I would like to tell you, that this is a question that I keep. I get this question often by, not only by students but also by certain friends and other people around me, that how do you balance? See, guys, you have to understand that a day has 24 hours. I've kept 7 hours, 6 to 7 hours for my sleep. Remaining 17 hours I've kept 10 hours for my work and remaining 7 hours for myself. In those 7 hours, sometimes I give 3 hours to my pleasure, 4 to my family, or 4 to my family, 3 to my family, 4 my pleasure. So you have to have that, capability to make zones. Like, you have to make sure that you switch off your phone, or at least divert your calls to someone once you enter your house. You might be anything and everything outside the house, but once you enter inside the house, you have to ensure that, people in your family, they want to see you. They don't want to see Dr. Drumel or Dr. Tushar. They want to see you. You might be god to others, but once you enter your house, you're just a normal, member of the family. And I have deliberately never mentioned anything what has happened in the morning in the OT or in the emergency or in the OPD on the dinner table. I never do that. I mean, I hate all those people who do that, in fact. And that is one reason I hardly go out now with the people of my fraternity, because we are having an enjoyable dinner and we are enjoying, and then suddenly someone starts telling that, what happened in this hospital, this happened. I said, boss, the professional life is over, time for personal space. We're spending, a good quality time, and we're having a good dinner. We're spending money. Let's utilize to calm down our nerves. I don't want any politics. I don't want any conversation of that sort. So I have this habit that, after a particular point of time in the evening, I make sure that my mobile is on silent. And if at all there is any emergency, my calls are diverted to one of my assistant, and he can take any emergency message and convey it to me. So I think that everybody should do. But yes, having said that, you can do that only after you cross that first phase of being salaried or self-employed. Because till that time, 24/7, you have to be available for your patients. Otherwise, you will have to make a name for yourself also. And availability of a doctor 24/7 is, I think, one of the basic necessities to make a good name in any of the area that you practice. So family life, you can balance it out on your own. You have to just make compartments for that. That's all.
Okay, thank you so much for that answer. One participant is asking that MS orthopedics or DNB. What are your views on it?
See, I'll tell you. I was honestly, I was getting MS orthopedics. I mean, I've said that many times before. I was getting MS orthopedics, but that was a tier two or a tier three city in one of the states. I never wanted to go there because I always wanted to stay in a metropolitan city. I had thought in my mind that I'll go to Delhi or I'll stay in Bangalore, but my rank never allowed me to take MS orthopedics in Delhi. It was my first attempt. I never wanted to take a drop. For me, drop was never an option. So in those days, DNB had no value. People never spoke about DNB. People never wanted to, talk about DNB. Even my family, I'm probably I'm probably the first and the last DNB in my family. My father is an MS, my uncle is an MS, my cousins have done their MS or MDs. My sister is an MD. So I kind of brought a revolution. Like, I told my father that I wanted to do DNB, and he was like, why? So I told him very clearly that for me, city is a preference. Because if at all I go, let us say if I do MS orthopedics at the next city and I will be away from Delhi for 3 years. So when I will come back, there will be a gap of 6 years. He said, how is this 6 years? I said, for 3 years I will be away. So that is a gap of 3 years. In those 3 years, Delhi will run another 3 years ahead. So there will be a gap of 6 years. And when I will come back, it will be very difficult to cope up for those 6 years. And I don't want to do that. So he said, you want to be in Delhi, you take a drop and get a better rank next time. I said, that's not possible. I'm getting an option of DNB. I'm joining it. Now, when I joined DNB, of course, my heart was broken in the first month, and uh, I could see that the number of cases were less. Quantity was certainly not up to the mark. My friends were doing orthopedics from a government medical college. I had a word with them. They told me very clearly that, Tushar, we have seen interlocking tibia, we have seen femur, we have seen both bone plating. And I was like, yeah, even hopefully next week or next month, I'll be able to, see that as well. But then by the end of first year, when I spoke with them, I said, I've seen 30 knee replacements or 20 hip replacements and five spine surgeries. They were like, do you guys do knee replacement? So that was the time I could understand by the end of my first year DNB that there are two aspects of orthopedics. One is the quantitative, one is the qualitative. DNB gives you the quality, not the quantity. MS gives you the quantity, not the quality. So if my peer, if my friend in entire first year had seen, let us say, 40 interlocking nails of tibia, I might have seen hardly, let us say, 5 or 7. Doesn't matter, but those 5 or 7 were done with state-of-the-art technology, with the most beautiful technique, which is explained just as in the book. While in his place, he might have assisted 2 or 3, he might have done an independent surgery also, but probably the quality of that surgery was not as good, because definitely in a corporate hospital, the equipments, the instruments that you have, they are superior than as you compare it with the government setup. So by the end of 3 years, I could analyze that I have seen a wider spectrum of cases than my friends who have done their MS. But yes, now it is the time to apply quantity. So I was pretty clear by the end of 3 years, ki Tushar, you have seen quality. Now you have to see quantity. For that, you require an SR ship in a government setup, and you have to, cope up with the quantity aspect also. It worked really well. I cleared DNB theory in first attempt. I cleared practical in first attempt, and I did not find any problem at all. DNB people are theoretically always superior because they have to read a lot. It's not they read a lot. Nobody wants to read in orthopedics, but they are made to read a lot as compared to the MS people. But I must say that doing DNB has been a blessing for me, and I'm really proud of that. And there is no hardly any difference now. People are doing DNBs, and now the difference is more or less covered.
Okay, thank you for that answer, sir. One question which is coming quite often is you've achieved so much already, and what you can just sit back and relax. But what makes you, what motivates you to go harder every day?
Okay, I think I will have to talk about the fourth phase now. It seems now. So, guys, okay, I'll disclose the fourth phase today. Uh, I told you the first phase is a salaried, the second one is self employed, the third one is a businessman. The fourth phase is, although not very right to convey to you guys are just in the budding phase, but still okay. I just hope that these words might ignite a fire maybe in any one of you. I'll be very happy if it happens, because it was ignited in me also by someone in way back in 2011. The fourth phase is being an investor. Now, when I say investor, that doesn't mean that you have to go to a hospital to earn a salary. That doesn't mean that you have to wake up every morning to dig a well and take water out of it. That doesn't mean that you have to work hard, and along with you you have to make 5 other doctors work hard so that you can make a name and fame out of you. Being an investor means you're not supposed to do anything. You're supposed to wake up, you're supposed to coordinate, you're supposed to put your money. That money will earn more money for you. So this is something, I mean, I'm telling you, this is too much for you guys. I mean, some of you might not even appreciate it right now. But when I say an investor, investor means that you have to just put in money with the knowledge that you have earned of these three phases, like the experience, the expertise, and the knowledge that you have earned after being a salaried person for 3 years, self-employed for 3 years, businessman for 5 to 6 years. So after all this period of 14, 15 years, the experience that you get, with that experience you have to couple that experience with money. You have to set up something so that many people who come to work every day, and they earn a lot of money for themselves, for you, and you can diversify. One person, Jay Vignesh, has mentioned very correctly, this is what is called as the concept of medical entrepreneurship. So when you enter into that fourth phase, this is at that point of time you diversify into medical equipment, you diversify into pharmaceutical, you diversify into education, you diversify into real estate, you diversify into anything and everything. Why I'm saying this? Because uh, I know that we all, 407 people right now, we have come with an expiry date. But the biggest part is that nobody knows that, when is the expiry date. हम सबकी है, लेकिन मालूम किसी को नहीं है. So I have a feeling that, I don't know about my expiry date. So before, I get expired, I want to inspire, perspire, and I want to see, feel, imbibe, absorb, achieve everything which is related to my field. I just want to breathe everything related to my field. I don't want to leave anything untouched, so that when I'm dying, I don't have this regret, oh shit, I left this. So just for that, I want to explore everything related to my field. I don't want to live a mundane routine life that okay, fine, this is how a doctor works, this is how a doctor lives. This is I get a negative feedback also from many people, including some in my family, that you are not no longer behaving like a doctor. This is not how a doctor works. This is not how a doctor behaves. I said, I don't care. I don't care at all. I have had enough of it. I'm doing it right now just to diversify. I want to explore anything and everything coming across my way related to healthcare, related to the education part, related to anything and everything around me. So this is the only thing which wakes me up every morning, and I take decisions so that I can shorten that span of achieving the fourth phase. I'm already into fourth phase. I'm establishing it. I'm not yet very successful in it, but yes, I'm trying with every passing day. And yes, one thing I can tell you very proudly, that first three phases, which normally people cover in about 10 to 12 years, or maybe sometimes 15 years, I covered that in 7.5 years. So I'm pretty happy about it. And I'm sure that, with God's grace and with blessings and love from you all, I'll be able to achieve my fourth phase successfully very soon. So that is the only driving force which wakes me up every morning and I go to my work.
Thank you for that answer, sir. I'm sure a lot of people, a lot many people, all the medical students, all wishes are with you for this thing.
Thank you.
Now coming to the next question, and in this age when people are planning of the next step and even the further steps, so people have asked us that what are the opportunities after you complete MS Orthopedics fellowship, either it is fellowship or something else.
Okay, I'll tell you. I think somebody from, I think some orthopedic surgeon must be there. He was asking that how is the practice and all those things. See, guys, you have to understand that in orthopedics, there is one arena called trauma. Trauma is the bread and butter of every orthopedic surgeon global. Uh, I would say that you can never leave trauma. You can become a joint replacement surgeon. You can become a spine surgeon. You can become anything. But to be very honest, you cannot leave trauma, because trauma is something which is the crux of the entire medical practice. So trauma has to be done universally. Now, apart from trauma, there is arthroscopy, the minimally invasive technique. There is arthroplasty, the joint replacement. Then there is spine. Then there is hand. Then there is foot and ankle. So there are different subspecialties, I prefer to call them. Now, what I want you people to understand is that all these subspecialties are there. I would want every orthopedic surgeon or budding orthopedic surgeon to understand a particular chronology. You are done with your post graduation. Please invest 2.5 to 3 years in your SRship. I have not done that. I am not the right person to preach this, but still, I was I was foolish, maybe, but I was lucky. I would admit in front of all of you that I was foolish. I did not complete my 3 years of SRship, but at the same time, I'm telling you, I was lucky. I don't know what went right in my way, but please make sure that you complete your 2.5 to 3 years of your SRship. In that senior residency, you start getting an idea that, okay, I have an affinity towards joint replacement or towards arthroscopy or towards spine or towards hand or towards foot and ankle. So these subspecialties, you don't have an MCH in India right now. You do have, by the way, there is one MCH which is running on right now in AIMS Rishikesh. If any orthopedic resident is there, AIMS Rishikesh is having an MCH right now, which is run very beautifully. Many of my students are there, but still majority of the places you don't have an MCH in all these subspecialties. You have fellowships. There are big names in all these subspecialties. You can go to them. You have fellowship of 6 months to 1 year to 2 year. You can train yourself under them. You can decide wherever you want to settle, and you can start working on that. But please remain, please have this belief that trauma is the bread and butter, and those 3 years of SRship will give you the maximum exposure to trauma. Don't skip that SRship. I get a message from many MBBS students or even who have got a good rank. Sir, I want to become a joint replacement surgeon. Beta, you have to first become an orthopedic resident, then an orthopedic surgeon, then an orthopedic senior resident. Then only you will become a joint replacement surgeon. The journey is 6 years from now. Orthopedics as a branch has got a very slow learning curve. It is very slow. In surgery also, that is around 10-15% easier than, the learning curve is easier comparatively, I would say. But in orthopedic surgery, the learning curve is very, very slow. So you have to be very patient. You will take a lot of time. And I would say that the only investment should be time, nothing else.
Thank you for that answer, sir. One question which is also recurring is after orthopedics or when you want to pursue orthopedics, what are your scope in USMLE and PLAB?
Okay, so first of all, you have to understand that if you're done with your post graduation, you have become a MS or a DNB or a diploma orthopedic surgeon. To practice in US, it is by far the law of the land of the United States of America that you have to clear USMLE for sure. No other way is there to go to US and practice orthopedic surgery. There is no fellowship. There is no other thing. Yeah, you can get a couple of observerships, but they don't allow you to operate over there. So you can be an observer, but to practice orthopedics there, to excel in orthopedics in US, you have to go through the USMLE. Now, as far as UK is concerned, right now the situation which is going on around us, UK is a country. I mean, I have a feeling there's a dictum also. UK is a very selfish country. UK, whenever they want, they ask for doctors. They don't consider any cutoff. They don't consider any criteria. They call doctors. They ask them to come and work. And maybe one day they realize that they have too much of them, and then they'll ask you to go back. So PLAB, as far as is concerned, that is not a good option. UK, I have never seen a good option for becoming an orthopedic surgeon over there. USMLE has to be cleared as far as US is concerned. And still, I would like to tell you that once you are done with your MS here in India, it will be a little difficult for you to manage things over there, because the nature and the nurture which you must have had here for last 3-4 years, when you will go to the West, you will find altogether a different kind of a word, and you will take time to adapt. That will confuse you more. Your family will be confused even more. So I think that's a bit of a confusion that happens. So if you've done post graduation from India, ideally better to stay back, stick to your country, which is given everything to you, and then it is the time for you to pay back. I mean, that is my thing. That this is my feeling personally.
Thank you so much, sir. One more question is asked that how important is orthopedics to venture into sports medicine?
Okay, I'll tell you something. I just hope that girl is listening. I got a message day before that a girl, I think, I suppose she was a girl only. I don't remember actually. But I think I got a message that, sir, I've joined sports medicine and I'm a little confused now. What should I do? Do you think that sports medicine will be at par with orthopedics? And my simple answer was that sports medicine is nothing but a glorified physiotherapy. uh, I don't want to sound rude to any physiotherapist. I don't want to demean the value of physiotherapy to my branch orthopedics. I have three physiotherapists who are working with me. They're my colleagues. They're my teammates for last so many years. But when I talk about sports medicine in India, doing a post graduation in sports medicine is nothing but a glorified physiotherapy, because uh, honestly, it is not having the required surgical component which a resident would want. If you want to become a sports medicine expert, you can do the sports medicine post graduation, but then you will have to go through 2 to 3 years of experience under an ortho to learn, unfortunately. I don't feel that sports medicine, still it will take time to come up. It will come up. I agree and I promise, but it will take a very very long time to come up in India. There is one more allied branch with orthopedics that is called the Department of PMR. If anybody has heard, physical medicine and rehabilitation. The way PMR could not establish itself as an independent branch, similarly, I don't see any future of sports medicine. So sorry to say that, but this is how orthopedic works. And sports medicine will never have a future. A standalone future will never be there, at least for next 2 decades, I can assure you.
Thank you for that answer, sir. We have a few more questions. So there are a lot many questions about how to stay motivated for NEET next and all the anxiety which is associated with it. So would you have any insights
Well,
on
I'll
that?
tell you about the motivation thing. I've said it in the past also. I'll say it today again. Motivation is something that is not. I mean, that is not something that can be acquired from outside. I mean, you cannot earn motivation, you cannot buy motivation, you cannot snatch motivation. Motivation has to be inside you. Motivation has to be in it. You have to feel motivated to actually, do something which you are passionate about. So we all lack motivation at times. I lack motivation at couple of times, and my mantra is always to wake up in the morning. I've told this in the past also, that I have to wake up in the morning. I just see my mobile for a couple of minutes, what all important messages, mails, and everything is there. I wear my spectacles. I go to my washroom. I take my brush. I put toothpaste on it. And the moment I start brushing my teeth, my first instinct is always, uh, thanks to whatever supreme power is there for making me alive today, for making for allowing me to wake up today. So what I this is my first thought, and it is there for last almost about 10 12 years now. Every morning, the moment I'm brushing my teeth, I have a feeling that God, thank you, मैं आज उठ गया हूँ, यही बहुत है. Because बहुत लोग आज उठे भी नहीं होंगे आज, I'm sure पूरे दुनिया में देखा जाए. So you have given me one more day to work. I don't know about tomorrow whether I will be doing the same thing again or not, but at least you have given me today. So, God, thank you for that. And the second thing is, God, now that you have given me a day, I have to utilize that day, because I don't know about tomorrow whether I'll be using the same toothbrush or not. So, God, you know what? I have got 24 hours, out of which 8 hours I don't think I'll be able to utilize. I have 16 hours. So what is the next step? Plan those 16 hours. So by the time I'm done with this, I'm done with my shave, my 16 hours are planned, and I'm highly motivated, because I have a habit of always establishing short-term goals. I have never established a long-term goal. I had never thought about, being here. I had never in my wildest of my imaginations thought of doing a Zoom call with all you people. I had never, in fact, I never had a dream of coming into education or coming into other things and coming of so many things that I've just spoken. Because I don't believe in long term goals, because I feel that long term goals are meant to be failed. So that is why I plan for a day, I finish that day, I make sure that I finish that well, and next morning again I plan my next day. Of course, that is somewhere in the back end, for sure it is there. Of course, I've planned my life accordingly. But yes, I try to keep that bigger plan or a larger plan towards the back end of my brain, and I try to keep the short term goals that I have, because I personally feel that one step at a moment, one step in a day, that is going to make me run longer, rather than having just bigger visions without any proper execution. So we all might have big dreams and everything, but guys, execution is the main problem. So execution does not come from long term goals. Execution comes from short goals, achievable goals. Because when you make a small goal and when you achieve it, that makes you happy. And for Tushar Mehta, the only thing is to remain happy. I have to ensure that every night before I go off to sleep, I have to feel happy. I have to be happy. I have to give happiness. I have to achieve happiness. I cannot sleep with remorse. I cannot sleep with regret. I cannot sleep with sadness. I have to be happy. Doesn't matter whether I wake up next morning or not, but I have to sleep happy. For me, happiness is the only thing. And to achieve happiness, I deliberately ensure that I have small goals which I can achieve every day, so that I feel that I have won the day. That is the only point.
Thank you for that answer, sir. So, as we are nearing the conclusion of this webinar, I would like you to uh, elaborate more on your message and what is your advice to the aspiring orthopedics which are joined by us.
See, I think I've given almost 90% of my message to you, and for the first time, I disclosed my stage four also. So my message is loud out and clear to all of you, that just don't aspire to become a doctor. Aspire to become a doctor to inspire the coming generation of doctors. Because again, something I would like to share. There was a seminar which was going on, and I was attending that seminar, and the speaker said, any questions from the audience? And one of the audience stood up and said, sir, is immortality possible? I will say it in Hindi also. क्या अमर होना संभव है? Is immortality possible? And the speaker said, yes, it is possible. If you say something, if you do something, or if you write something, that even when you are gone, people will remember you. You will become immortal. I will translate in Hindi also. कुछ ऐसा कह जाइए, कुछ ऐसा कर जाइए, कुछ ऐसा लिख जाइए कि या तो आपको जला दिया गया हो या आपको दफना दिया गया हो, अगर उसके बाद भी लोग याद करें कि क्या कहा है, क्या लिखा है, क्या किया है, तो आप समझ जाइए आप अमर हैं. So that thought, when I attended that seminar, I remember it was in Indian Habitat Center, Delhi. There's a place called IHC in Delhi. So I attended that seminar, and when I came out of that seminar, the only thing which was stuck in my head was this answer, that I have to do something, I have to say something, I have to write something. कुछ कहना है, कुछ करना है, कुछ लिखना है. So from that day, I started writing a lot of things on my social media, on my website. I started doing a lot of other work. I started, all those things. So my message is loud out and clear to you that please, please, guys, make sure that you have to aspire to inspire. If you are not inspiring the budding generation, the coming generation, the younger generation, then your life is a waste, because whatever you are living right now is not going to be remembered in 2015, 2017, 2120, or if, I mean, I just hope Corona ends then. So if all, life goes ahead, you should be remembered. And if you live every day of your life with this thought that you should be remembered, you will always achieve heights, you will always do good work, you will always do great work, you will do even an ordinary thing in an extraordinary way that people will remember you forever.
That was extremely insightful, sir. I would like to thank you for joining us and giving us such a motivational talk on orthopedics, and not only on orthopedics, on life in general, which is
Thank
so essential to future medicals and future doctors, surgeons. So I would like to thank you once again for joining us, and be looking forward to hearing more from you, and wish you all the luck, sir.
Pleasure is all mine, guys, and thank you to all the listeners and viewers here. And I feel blessed to be loved by you. Your affection, you guys have appreciated, and I must thank you and I must congratulate all of you once again. But please remember that if you will want this much, you will achieve this much. But if you will want this much, you will achieve more than that. So keep your aims high, keep your hopes high, and say it out loud. Put it on social media. If you have any dream, दुनिया के आगे खुल के बोलो, डरने की जरूरत नहीं है. The universe will be there to serve it. Thank you so much. Bye bye. Have a good night and a good session. Thank you, Dhrumal. Thank you so much.
Thank you, sir. Thank you. Okay, so all the participants, you're requested to fill out this form, the post-webinar form. It would be, we'd really appreciate it if you fill it out, and it is essential for us to evaluate the process. For those who want a summary of the session, this session will be available on YouTube later on. So you can watch the entire session after a few days. Also, those who fill out this form will get a certificate. So I request again to fill out this form. I'll send the form once again, and after filling it out, you will be getting a certificate after some time.